Hold on. If you've been dragging yourself out of bed, running on 3 coffees just to function, or staring at the ceiling at 2 a.m. with a racing mind, what if the problem isn't stress? What if it isn't your diet? What if it's one invisible number on a blood test that your doctor never ordered?
Research shows that over 40% of American adults are vitamin D deficient. In some states, that number climbs to 70%.
And the scariest part? Most people have absolutely no idea. Because vitamin D deficiency doesn't announce itself. It disguises itself as everyday modern life.
Stay with me, because in the next 10 minutes, I'm going to walk you through 5 specific signs your body is begging for vitamin D. Signs that most doctors overlook entirely in routine checkups.
Why vitamin D is uniquely dangerous to ignore. Here's what makes vitamin D different from every other nutrient deficiency. It's not technically a vitamin at all. It's a steroid hormone, one that regulates over 200 genes in your body. It controls your immune system, your nervous system, your bone density, your cardiovascular health, and even your mental health.
When it's low, nothing works at full capacity. But because its symptoms overlap with stress, aging, and burnout, it gets dismissed for years.
The standard American diet provides almost none. Sunscreen, which we all use, blocks the skin synthesis that creates it. And unless your doctor specifically tests for it, you'd never know. This is why I call it the silent drain on your health.
The 5 signs. The first sign, persistent fatigue that doesn't respond to sleep. We're not talking about being a little tired. We're talking about waking up after 8 full hours and feeling like you slept 2, reaching for caffeine before you've even brushed your teeth.
Vitamin D is directly involved in mitochondrial function, the process inside every cell that converts food into usable energy. When your D levels are low, that conversion becomes inefficient. Your cells are essentially running on a dying battery.
A 2015 study published in the North American Journal of Medical Sciences found that patients who corrected their vitamin D deficiency reported a significant reduction in fatigue within just 8 weeks.
The second sign, unexplained bone and lower back pain. Before calcium can enter your bones, it needs vitamin D as the gatekeeper. Without it, calcium circulates in your bloodstream, but never gets properly deposited into bone tissue. The result? Bones that are structurally weakened, sensitive to pressure, and prone to aching, especially in the lower back, hips, and knees. Many Americans are diagnosed with non-specific back pain and sent home with ibuprofen when the actual issue is a vitamin deficiency. In severe cases, it progresses to a condition called osteomalacia, adult rickets, where bones literally soften. You don't want to get there. The third sign, depression, anxiety, or persistent low mood.
Your brain is packed with vitamin D receptors, particularly in regions associated with mood regulation, like the hippocampus and prefrontal cortex. Vitamin D helps regulate serotonin synthesis. When levels drop, serotonin drops with it. This is why seasonal affective disorder, the winter blues, is directly correlated with vitamin D depletion from reduced sunlight exposure.
A meta-analysis of 14 studies found that individuals with depression had significantly lower vitamin D levels than those without. This doesn't mean every depression is caused by vitamin D deficiency, but it means it's always worth checking before reaching for other interventions.
The fourth sign, getting sick too often and taking too long to recover.
Vitamin D is one of the primary activators of the innate immune system, your body's first line of defense. It directly triggers the production of antimicrobial proteins called defensins and cathelicidins. When you're deficient, T cells, the specialized immune cells that identify and destroy pathogens, can't fully activate. It's like having an army that hasn't been given orders to fight.
Multiple randomized controlled trials have shown that vitamin D supplementation significantly reduces the incidence and severity of respiratory tract infections. If you catch every cold that goes around the office and you're still coughing 3 weeks later, check your levels.
The fifth sign: hair thinning or increased hair loss. Hair follicles contain vitamin D receptors. Vitamin D is needed to stimulate the anagen phase, the active growth cycle of each hair strand. When D is deficient, follicles spend abnormally long periods in the telogen phase, the resting and shedding phase. This manifests as diffuse hair thinning across the scalp, not patchy bald spots. It's particularly common in women and is frequently dismissed as hormonal, stress-related, or genetic, when the fix may be as straightforward as addressing a deficiency. A 2021 study found low vitamin D levels in patients diagnosed with telogen effluvium, a common form of hair loss. It won't hurt to rule it out. Action steps. Step 1. Request a 25-hydroxy vitamin D test, written as 25-OHD on your lab order. Most insurance covers it. Ask your primary care physician or order it through direct lab services. Step 2. Know your number. Anything below 20 nanograms per milliliter is deficient. Between 20 to 29 is insufficient. Between 30 to 100 is normal range. Optimal for most adults, 40 to 60 nanograms per milliliter. Step 3. Do not self-supplement megadoses without testing first. Vitamin D is fat-soluble. It accumulates in your body. Toxicity from oversupplementation is a real, documented risk. Step 4. Safe sun exposure. 10 to 20 minutes of midday sun, 10 a.m. to 3 p.m., on arms and legs, without sunscreen, several times a week. This varies by skin tone, latitude, and season. Step 5. Talk to your doctor about the right supplementation protocol for your specific level, not a generic internet dose.
Before you go, I want to ask you something. Out of those 5 signs, fatigue, bone pain, low mood, getting sick all the time, or hair loss, which one hit closest to home? Drop the number in the comments, or just write all 5, because honestly, that's what I hear most.
If this gave you something useful, the subscribe button is right there. Not for me, for you. Every week I put out one video like this. Real medical information, explained clearly, without the hype, without the sponsorships pushing products at you. Turn on the bell so you don't miss the next one. It might be the one that changes something for you.